breaking news today.
Please subscribe and then check notification box to get all breaking news alerts.
U.S. Airport. CDC just issued urgent warning. The New Jersey Department of Health officials has just sent out an urgent warning to passengers who have traveled through the Newark airport, warning them they may have been exposed to a highly contagious disease. Passengers who traveled through Newark Airport in New Jersey were issued a measles exposure warning on Friday after the Department of Health confirmed that one international traveler who came down with a highly contagious disease had gone through the airport on January 2, one of the busiest times of the year for travel. The alert confirmed that on January 2, 2018, an international traveler with a confirmed case of the highly contagious measles virus arrived at Terminal C at Newark Liberty International Airport and departed for Indianapolis from a domestic terminal. Authorities did not confirm which domestic terminal the passenger used, but in a statement issued by the Department of Health of New Jersey said that the woman was identified as an Indiana University student. Anyone who was at Newark Airport on that day between the hours of 6:30 a.m. and 5:30 p.m. may have been exposed to measles. If infected, symptoms could show up as late as January 23. The disease, which was largely eradicated during the past decade, began to re-emerge several years ago, due to immunization fears and an influx of immigrants which our nation doesn't need or want. Measles can be easily spread via coughing and sneezing or coming in contact with the mucus or saliva from an infected person. New Jersey health departments are in the process of notifying passengers who were potentially exposed on the infected passenger's flight, and they are asking anyone who believes they are infected to go to the doctor or an emergency department. The Los Angeles Times reports. Vaccine refusal helped fuel Disneyland measles outbreak, study says. The actual number of measles cases linked to Disneyland shows that the vaccination rate may be as low as 50%. Although epidemiologists have not yet identified the person who brought measles to Disneyland, a new analysis shows that the highly contagious disease has spread to 7 states and 2 other countries thanks to parents who declined to vaccinate their children. Using some simple math, a team of infectious disease experts calculated that the vaccination rate among people who were exposed to the measles during the outbreak was no higher than 86%, and it might have been as low as 50%. In order to establish herd immunity, between 96% and 99% of the population must be vaccinated, experts say. Even the highest estimated vaccination rates from our model fall well below this threshold, the researchers reported Monday in the journal JAMA Pediatrics. The analysis underscores that, in preventing outbreaks, it's not just about policy but about compliance, said Iraz Hatna, an infectious disease modeler at Johns Hopkins University Medical School who isn't involved in the study. The measles outbreak. It's a compelling analysis, added Dr. Mark Schliss, a pediatric infectious diseases expert at the University of Minnesota who didn't work on the study either. In light of its findings, it's surprising we don't see more of an outbreak. The research team, from MIT and Boston Children's Hospital, calculated the range of likely vaccination rates based on a few key data points. Based on historical data, infectious disease experts know that in the absence of any vaccination, a single person infected with measles can spread it to between 11 and 18 other people. They also know that it